Parasites are organisms that live on or in a host organism and get their food from or at the expense of their host. There are several types of parasites. They can be microscopic, such as protozoa, or quite large, like tapeworms. They can infect various areas of the body, from the intestines to the bloodstream to the skin. Signs of a parasitic infection. The symptoms of a parasitic infection can vary greatly depending on the type of parasite and the area of infection. However, some common signs may include gastrointestinal problems such as diarrhea, abdominal pain, nausea, constipation, and bloating. Unexplained weight loss. Fatigue or weakness. Skin problems, including rashes, sores, lesions, itching. Changes in appetite, either increased or decreased. Anemia, caused by certain types of parasitic infections, such as hookworm. Fever and other systemic signs of infection. Best ways to get rid of parasites. The best treatment for a parasitic infection depends on the specific type of parasite involved, the area of the body affected, and the severity of the infection. Here are some general methods of treatment. Antiparasitic medication. Many parasitic infections can be treated with specific antiparasitic drugs, which are designed to kill parasites or inhibit their growth. Good hygiene practices. Washing your hands regularly and thoroughly, especially before eating or preparing food, can help prevent many types of parasitic infections. Safe food and water practices. Cooking food thoroughly, washing fruits and vegetables, and drinking safe water, i.e., boiled or treated water, can also prevent many foodborne and waterborne parasitic infections. Regular checkups and screenings. If you live in or are traveling to an area where certain parasitic infections are common, regular medical checkups and screenings can help catch any infections early, when they're typically easier to treat. Remember, if you suspect you have a parasitic infection, it's crucial to get medical advice rather than trying to self-diagnose and treat. A healthcare provider can offer the most appropriate advice based on your symptoms, medical history, and specific situation. Parasites can be transmitted in several ways. Contaminated water. Drinking or bathing in contaminated water can lead to a parasitic infection. This is particularly common with parasites like Giardia or Cryptosporidium. Contaminated food. Consuming undercooked meat or fish, unwashed fruits and vegetables, or food prepared by an infected person can also transmit parasites. Person-to-person contact. Some parasites can be transmitted directly from person to person, particularly if good hygiene practices are not followed. Animal-to-person contact. Animals, particularly pets, can transmit parasites to humans. This can occur through direct contact or contact with feces. Insects. Certain parasites, like malaria, are transmitted by insects, particularly mosquitoes. The side effects of parasitic infections vary greatly depending on the type of parasite, the area of the body affected, and the severity of the infection. However, some possible side effects include digestive issues. These may include nausea, diarrhea, abdominal pain, bloating, and loss of appetite. Weight loss. This can occur as a result of decreased appetite or malabsorption of nutrients due to the parasitic infection. Fatigue. Many people with parasitic infections report feeling extremely tired or weak. Skin problems. Certain parasites can cause rashes, itching, or other skin issues. Anemia. Certain parasites, such as hookworms, can cause anemia by feeding on the host's blood. Fever and other systemic issues. Parasites can cause fever, chills, and other signs of systemic infection. In some cases, if left untreated, parasitic infections can lead to more severe complications, such as organ damage or malnutrition. It's essential to seek medical care if you suspect you have a parasitic infection.